Hello everyone, today we are going to take a look at the dissection of the neck. And if you look at the side of the neck, you can see that it is roughly a large rectangle with its anterior border being formed by the anterior midline of the neck extending from just below the chin along the anterior midline up to the suprasternal notch. Posteriorly, it extends from the external occipital protuberance along the nuchal furrow at the back of the neck to the spine of the seventh cervical vertebra. Above, it extends horizontally from just below the chin, that is the symphysis menti, along the lower border of the body of the mandible, then extending below the lobule of the ear and going right up to the mastoid process. From there, following the superior nuchal line back to the external occipital protuberance, and below horizontally from the suprasternal notch in front along the upper margin of the clavicle, going on to the upper border of the scapula and rounding back to the spine of the seventh cervical vertebra. And within the confines of this broad rectangle, you can see two muscles, the outlines of muscles. Posteriorly, this is the trapezius, and anteriorly, this one is the sternocleidomastoid. And you can make out that the sternocleidomastoid acts as a diagonal of this large rectangle to separate it into an anterior triangle in front and a posterior triangle behind. Now this anterior triangle has got its apex below at the suprasternal notch and the base above, extending from the lower border of the mandible up to the mastoid process, and the posterior triangle with its apex on the superior nuchal line and the base on the middle 1/3 of the clavicle. So anterior triangle, anteriorly the anterior midline of the neck, posteriorly the anterior border of the sternocleidomastoid, and above lower border of the mandible, and from the angle of the mandible to the mastoid process. Now this anterior triangle is further divided by certain muscles into some other subsidiary triangles. Now before you go into the depth of these tissues, if you dissect from the surface downward, beneath the skin you are going to come to a layer of subcutaneous tissue, the superficial fascia, which contains a muscle called the platysma, as well as superficials, veins, arteries, nerves and lymphatics. The nerves being derived from the cervical branch, the cutaneous branches of the cervical plexus. So if we look at this next picture, here you can see that subcutaneous muscle, the platysma, through which you have to go deep to go into the contents and the floor of the anterior triangle. Now if you look at this cross section of the neck, you can have an idea of the structures that you will have to cut through to get through the anterior triangle. Below the skin, here you can see there is this platysma muscle within the subcutaneous tissue, and here you have the investing layer of the deep cervical fascia enclosing the sternocleidomastoid in front and the trapezius behind. And only when you have cut through the investing layer of the deep cervical fascia can you actually get into the component parts of the anterior triangle. So now if we have come into the anterior triangle, you can make out that there are sub-triangles, smaller triangles within the anterior triangle, and there are two key muscles over here. One is the digastric muscle with its anterior belly, posterior belly and intermediate tendon anchored to the hyoid bone, and the omohyoid with its superior belly in the anterior triangle, inferior belly in the posterior triangle, and intermediate tendon anchored to the clavicle by a slip of fascia derived from the fascia, the clavipectoral fascia. And now you can see that the anterior triangle is further divided into a half triangle over here, the submental triangle, which is complemented by the half triangle on the opposite side. This here is the digastric triangle between the limbs of the digastric muscle. Over here you have the carotid triangle between the posterior belly of digastric and the superior belly of omohyoid, and near the midline you have the muscular triangle between the superior belly of the omohyoid and the anterior border of the sternocleidomastoid and the midline of the neck. So let us take a look at some of these triangles. At first, let us consider the submental triangle. If you look at the submental triangle, you will find that it is a half triangle on each side. The apex is formed by the lower border of the symphysis menti, that is the tip of the chin, and the base is formed by the body of the hyoid bone, and on the sides you have the anterior bellies of the digastric. And now we will take a look at the floor. To see the floor, we will go into a different picture. Suppose we look at this picture. Here you can see the two halves of the submental triangle. You can see the anterior bellies of the digastric and the undersurface of the chin. And the floor you can see is formed by this muscle. The floor is formed by the mylohyoid muscles of the two sides, which meet at the middle at a raphe to form what is called the oral diaphragm or the diaphragm oris. And the contents of the submental triangle are a few submental lymph nodes and the beginning of small veins over here called the anterior jugular veins, which go down and drain into the external jugular vein. Now these muscles, the digastric, mylohyoid, underneath the mylohyoid you have the geniohyoid, and over here you have the stylohyoid. So digastric, mylohyoid, geniohyoid and stylohyoid, these are together called the infrahyoid muscles. Now going beyond the submental triangle, let us go into the digastric triangle. In the digastric triangle, you will find here above you have the lower border of the mandible and a line extending from the angle of the mandible to the mastoid process. So the digastric triangle is quite an elongated triangle. It does not stop here, it goes here. And below and behind you have the posterior belly of the digastric, and below and in front you have the anterior belly of the digastric, and the floor is formed by the three muscles mylohyoid, hyoglossus and a part of the middle constrictor, which you can't see here. Let us see here. You can see the middle constrictor here, but you can see a little bit of the hyoglossus here. So you have the mylohyoid, hyoglossus and middle constrictor. See, mylohyoid, hyoglossus and middle constrictor. Now to study the contents, you have to study in the anterior part of the triangle. The contents are the superficial part of the submandibular gland, the submandibular lymph nodes, the facial artery and vein. Somewhere here you have the mylohyoid vessels and nerve, and you have a part of the hypoglossal nerve and its accompanying veins. Now hypoglossal nerve, where you can't see them here, and you can see them here in this details. Here you can see mylohyoid, hyoglossus, hypoglossal nerve resting on the hyoglossus muscle. Now the posterior part of the digastric triangle is quite elongated, because the posterior belly of the digastric is also much longer than the anterior belly. And you can see here that the posterior part of the digastric triangle, and you can see that this intermediate tendon is also held in position by a split in the stylohyoid muscle, forming a sort of a clasp for the intermediate tendon. And in the posterior part of the digastric triangle, you have a lower part of the subparotid gland descending from the face. Then you have the external carotid artery entering the parotid gland. You have the carotid sheath with the internal carotid artery, internal jugular vein and the vagus nerve. So this digastric triangle effectively has a lot of structures entering it. So if you look at this picture, you can see again the elongated digastric triangle, its small anterior part, large posterior part. If we can look at a better picture, here again you can make out a large part of the digastric triangle here, over here, and here you can make out this is the digastric triangle over here. This is the digastric triangle. So we will come back to our original splitting up of the anterior triangle: submental triangle, digastric triangle. Now we are left with the carotid triangle and the muscular triangle, which we will discuss in a